Whether I'm the right person for the job or not, I leave it to your judgment. I can't sit here and say, yes, I'm right and all that. I gave my account, even to Life is the Main, to Judge Motsoaledi, and he made his own judgment about what has happened. You can go and look at it. The SIU has given an interim report about their findings as to who is going to be charged, who did that.
Including doctors. And notwithstanding the biggest medical tragedy in post-apartheid South Africa, I'm referring here to the Life SC Dimeni saga. All this under the watch of my guest here on As It Happens, Health Minister Dr. This is our nightly look at South Africa under the Ramaphosa administration. This is As It Happens. Well, Health Minister Dr. Aaron Motsoaledi has admitted that state hospitals are struggling with overcrowding, but says these foreign nationals are adding to the burden. Motsoaledi has had a tiring 48 hours fielding questions about the deteriorating public health sector. He joins me now. Dr. Motsoaledi, thanks very much for talking to us this evening. You know, earlier today, listening to and watching your demeanor, you know, how you were responding, more especially to the Health Ombudsman's criticism of the health sector. You seemed to be trying very hard, one must add, to be composed.
No, I'm not sure. I thought I'm always a composed person. And I thought in all press conferences, I try my best to be composed. I was not aware that I was trying very hard today.
Well, I mean, it seemed from, are you having to, one, point out, you know, that there are rules and regulations that he needed to follow, that he's, or they aren't, you know, in the health, in the business of news, of being news health analysts, that they are a statutory body. I'm having to point out those suggested that you were aggrieved, but just couldn't get to saying it.
No, I was not aggrieved. I was confused, and that's why I phoned the Health Ombudsman. It's a statutory body. It's not like a news analyst who gives opinions. If the Auditor General said the finances of municipalities have collapsed, he has done an audit. He will show you scientifically what he meant when he said this has collapsed. If State South Africa tell you the gross domestic product in this quarter has gone down, there are studies which have been done, the methodology. When the Ombudsman reported to us about Life is the Main, I'm sure you saw the report. It was very well studied over a period of 2 months. He brought in psychiatrists and he outlined the methodology and the findings and why he arrived at certain recommendations. So all I was doing was to find out what led to that, because I don't have such a report. I wanted to know which studies were done, what figures did they produce, where were they done, what's the methodology, what is the report. For instance, Professor Makgoba works in the Office of Health Standard Compliance, which is required by Parliament, by the way, to go and report. Today they were reporting, they've done inspections in a number of hospitals and clinics in the country. That's what they always do. And they follow a particular methodology. They've got a measuring rod that this is measured in this way and that way. And I said, if they go to measure and say, our result is that this is a collapse, then you understand, because you know exactly what has been done. So that's all I was asking, that I don't remember such a study by the Umbat, and I actually phoned him to find out how he arrived at this conclusion, because I said maybe there's a report which I've missed somewhere. So now Vuyo, you, for instance, there is a person, I think is the president of DINOSA, who just said, you were interviewing him, I was listening, he said the World Organization has declared that the healthcare system in South Africa is the weakest in the whole world. There's no such a report. There's absolutely none. One of the newspapers once said that, I think it's last year. And I phoned the World Organization and said, which report are you referring to that declared us as the weakest healthcare system in the country? And they said, no, we don't have such a report. But what they said, what they remembered was that there was a study based on 1995, and one of the main criteria which was carrying a heavy weight was equality in healthcare. And they said South Africa was the most unequal in healthcare system. That we know to be true. Yes. So for somebody to take it and say, they said, this is the weakest healthcare system, I've got the right to ask, but which study are you referring to? Because we have got to be scientific.
So are we to assume then that after you made the call to the Ombud yesterday, you couldn't, or he couldn't give you a good enough reason to accept what he had to say, because presumably he did no study? In other words, the Ombud woke up and basically thumb-sucked what he had to say.
No, I don't think he woke up. People go to him and complain. It's possible that maybe he took the sum number of complaints.
He didn't clarify that during your conversation yesterday when you called him?
No, he said what he meant is that there are certain rules stemming from the acts that were passed after 1994, which, if they are not changed urgently, then there's an imminent collapse. He said he was meaning that. I'm sure it will be very important for you to ask him. The part of what I understood is that if you look at the Life is the Main report, he does, out of the 18 recommendations, he does make 2 and say, in order for things like this never to happen again, number 1, we need to review the National Health Act 2003. It needs to be changed. Number 2, he said we need to review and change the Mental Health Act. And he gave reasons there why they must be changed. But as an interim measure, he wrote there and said, when projects like this are undertaken in the future, no MEC can go on to do this unless it is approved by the minister. That's interim until the laws are changed. So when he then explained to me that he meant laws have to change, I understand that, because in the NHI, we came across the same thing, that 12 acts have to change if we are to have a good quality healthcare system for everybody. Even the Law Reform Commission has studied all the acts. And I think 2 months back, yes, they gave us a report in the National Health Council that says there are 108 acts that govern health, and for the institution to improve, they said 39 of those acts need to either be amended or repealed altogether, or at least consolidated. So that's how he explained it to me.
Well, I want us to take a listen to something he said, in fact, rising to your defense on the Life as Itimeni tragedy, which to many people suggests or proves that he wasn't being malicious or just saying what he said yesterday simply because he had nothing to say.
People kept on saying, where was Dr. Motsoaledi? Dr. Motsoaledi could not be anywhere because the Constitution did not allow him. And when you looked at the National Health Act and look at the previous act of the apartheid era, where the national minister had the power, those powers had been taken away in the new dispensation given to the provinces. And that's why in one of my questions to the MEC was, why was the minister not informed? And she was pointed to me and said, well, I did not need to inform him. This falls within my sphere of governance. And she was right, because that's what's in the Constitution.
So, looking at that, well, that is only part of what he said. I mean, here's a man who's like prepared to concede, like, was that in fact is what is happening. But, well, my reading of it was that he felt the need to actually talk about the other issues that he feels, you know, are not being addressed when you look at, you know, the health of our health system in its entirety.
I don't understand where you are headed to, Vuyo.
Well, I'm saying here's a man who's prepared to concede that you were severely constrained in how you could have, for example, dealt with the Life Esidimeni a tragedy, that it was not your fault. It's no reflection on you. But where he felt there were bigger, you know, health system issues that needed to be highlighted, he felt he needed to do so.
Yeah, but I'm not saying he's wrong. All I was saying is I was asking, how was it arrived at? The Life Esidimeni thing is mentioning. I'm not asking because I've got the facts and I've read this report, but I also know what he's talking about. For instance, when he said the acts during apartheid era, if you look at the law that was used for mental health people, before 2002 Mental Health Act, it was enacted in 1973. And in 2002, we justifiably said, the government said justifiably at that time, I was still in a province, but at national level, the government justifiably said, this act has got no human rights in it, because it had words like incarceration, arrest, and all such things. So they put a new act, but they then said no, but delivery is taking place at the bottom, at the provincial level. Why give authority to the top? What were they talking about? In the 1973 Act, the power to deal with mental health patients laid with the president, number one, the minister, number two, and the magistrates, number three. But all those powers were taken together and given to the MEC, and that's what Professor Makgoba was talking about. If you go to the 1973 Act, it says the final decision to, for instance, move a mental health patient from one institution to another, or even to institutionalize them, lies with the Mental Health Review Board. But it goes on to say, even after taking such a decision, they cannot implement it until the minister approves it. Now, that is what is not there on the new act, and that's why he said he's adding an interim measure. So on that regard, I agree with you, and I know what he's referring to in the methodology. But the other issue of collapse, I was just asking to see, I wasn't fighting, I was just saying, can I see exactly what are the facts that led to this? Because surely, Vuyo, if that is the case, I need to know where to touch, like in Life Esidimeni. We already know when we're implementing that report, there were 18 recommendations. We know where to touch, we know where to go, we knew what to do.
When we return, Dr. Motsoaledi diagnoses as well as prescribes some medicine for the broader health illnesses that we are confronted with today. This is As It Happens.